Our number one goal is to avoid progression of their disease. And if we expose them to contrast and cardiovascular procedures that can cause acute kidney injury, we can actually accelerate or worsen their renal function. So we're really trying to prevent that. Contrast volume threshold is very important. We really want to monitor contrast like we do radiation, where we're keeping account of how much contrast dye we're using. A threshold tells everybody in the Cath Lab where we want to stop or slow down with our contrast injections. And it also guides us to tell us where the risk for that patient really increases with regards to the volume of dye and the renal function. So real-time monitoring, again, much like radiation, allows us to know shot by shot how much dye we've used, and we can tailor our approach accordingly. So we may stage a patient for an intervention at a later date. We may decide to stop a procedure if we're not proceeding the way we want to and we've reached that contrast dose limit. So the types of procedures that I would think about using DYEVERT Plus on are one, obviously the patient has chronic kidney disease and needs a coronary or peripheral angiogram. Heart failure patients who are decompensated, they may benefit from this use of this technology. Diabetic patients. And then the less common patients that you may not think about are the ones that have normal renal function and no diabetes, but are going to get a prolonged exposure to contrast, a complicated procedure with hemodynamic shifts. Those patients may actually also benefit from the use of this technology. Using DYEVERT Plus in a STEMI patient is actually quite ideal, and now with the DYEVERT Easy, it's even quicker setup, so that concern about impinging on the door-to-balloon time may be less if you can set up the system early. Patients who have STEMI, they come in without us knowing about their renal function, so we don't have labs back, and that population is at risk for acute kidney injury. So the DYEVERT Easy makes sense in that population. The DYEVERT Plus system, what do I really like about it? The fact that I can monitor their contrast use shot by shot over time. I can set thresholds, and then I know that I can get 40% savings compared to not using it. So it really gives me a buffer in terms of doing complex procedures.